My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Here we are with another interesting topic on dementia. So if you know of someone or you are starting to experience issues around this, please make sure you stay with us, as we'll be unpacking this topic in an interesting way. Welcome.
Hi viewers, welcome back to the Dr. Alternative show. Our focus is on dementia, the topic that we are discussing today. So stay tuned. Thank you.
What is dementia? Some people may know it, some may not know. But to put us on the same wavelength, I've prepared this clip for you. Please take a look.
The brain is the engine of the body. Your memory is managed there. Your personality, your intellectual abilities, your emotions. You name it, the brain is there. Once this brain gets damaged, whether seriously or lightly, the course of action changes. Those functions take a nosedive. When the adverse effect is so extensive that there is huge cognitive decline, and the person's memory is so bad that they cannot function independently, then dementia has set in.
I don't know who your mother and father are.
You don't know who my mother and father are?
No.
I'm going to tell you. Are you ready?
Yeah.
You're my father, Pop.
What?
You're my dad.
I'm your dad?
You had me, yeah. I'm 50% you, your DNA.
Who's the other 50?
Joanne.
No kidding.
Yeah, Joanne is my mom and you're my dad.
Oh, that's great. I'm glad to hear that. I feel good about that.
Pop, I feel good about it too.
There are different types of dementia, but all roads lead to serious memory and cognitive decline.
Welcome back. Before we proceed with the topic of today, there was a YouTube video that I used to follow. This gentleman is a white gentleman who is a retired podiatrist, a doctor who works with feet, the footed doctor. Yeah, he used to work with feet, but now he's retired. But his son kind of did a podcast, not a podcast, I mean a reality, yeah. So, and where they would follow him around, and I'm like, yo, how I wish I could actually get hold of this son. And if he was in South Africa, I would really have reached out, because the reason why I felt like this is I can see that they have accepted that this is his fate and he's going to keep deteriorating up to a point where he doesn't even know whether he's coming or going, because already could not recognize his son. Sometimes he would, sometimes he wouldn't, in and out kind of episodes. But the impression I have is that people who have got dementia or Alzheimer's, that is it. Even if you watch the movies and the whatnot, you'll find that is it. Once you reach that level, then they can only maybe just write things for you or whatever. But it looks like the belief is that it's a done deal. Once you reach there, there's no turning back. That is what I'm disproving in our discussion today. As usual, Lorica is going to be guiding us or directing us with her questions. And some of these questions, we actually draw them from your correspondence with us via emails. In some cases, it's not the questions, it's where you ask us to cover certain topics. So we're trying as hard as possible to respond to your requests and to your questions.
Thank you very much, Thembi. I hear people saying, once you start forgetting where you put your car keys or where you park, you should worry.
Yeah.
How true is this?
Of course you should. Not because you've got dementia. Not because you've got dementia, but once you don't know where to find your keys and you've got to leave.
Or even your car.
I mean, it's a problem. You should worry. Okay. But anyway, it's more serious when it is actually dementia. But you must know that this may very well be an onset of dementia. It doesn't mean it always is the case. I mean, I remember I laughed one time. I was at the mall and I'm thinking. I mean, they are working they are working in this mall, so there's a section where they've cordoned off. So I'm managed to drive through that, but now and so it's not the usual parking that is that, but because of all these. Now I'm coming out and I'm like, where did I park? Where did I park? I was only to realize that, no, because of this construction, I ended up going to park under the under parking inside the building as opposed to outside. So now when I was going, because now I go out the front and I'm thinking, where did I park? Only to realize that, no, I ended up going to park inside. Now, dementia knocking. Dementia knocking. But anyway, I will nail it. I mean, if it's dementia, of course, I mean, I will be able to pick up. But that it doesn't mean when you forget where you've put your keys, or it's always, that's just memory. Dementia is the diminishing of your memory. But when it diminishes to such an extent that you become dysfunctional. Okay, you cannot remember things. But small things like where you go, maybe you come out of the room, you go to the kitchen, and you're like, what did I come here to do? That's an onset of age. I mean, I do experience that. And then I open my phone, and because there are so many things, Lorica's this, and then it's one, and then it's that, and then then now you're talking to, and then you open the phone, then you say, oh, a string of WhatsApps that you have not even opened, and now you see one that, oh, this one is urgent. So you end up forgetting. Why did you open? Because you opened your phone for a particular, not for these WhatsApps, but because they are the first thing that comes to your face. Then you end up being caught by that particular one. Then you attend to that. Then you're like, why did I open my phone? So I'm actually a victim of that. I mean, seriously, I do experience that. It's not a lot, but I do experience it. Of course, with age, your memory deteriorates. Not only because of age, there are so many things that affect the brain. Because, I mean, with the students, I tell them that and then they say, yeah, my memory is deteriorating. I used to be sharp, I used to remember things, but now, and they're still at school, they're still a student. So it doesn't necessarily go with age, it goes with what is affecting the brain, where your memory is managed, you know? And there are so many things that may be affecting even epilepsy, the one that we covered in the previous episode. when you get these seizures, you may have issues with your memory. So it doesn't mean when you are having these, you forget your keys and you should start worrying. But of course, if it's something that's persistent, you need to check, why am I losing my memory? Why is it deteriorating? It may not necessarily be dementia, I mean at that level of dementia, but memory is affected. And memory does get recharged. That's what is nice, that you can recharge your memory so that you're back on track again. But you've got to know, why is it deteriorating? Because even this thing of the memory deteriorating because of age, that's also relative. Because age in our times is because, that's besides the number, but that's because it's years of eating rubbish, of being exposed to pollution, of this and that, which is so unhealthy for you. But because you've been having it for a long time, then you end up associating with, and my brain is now deteriorating. Whereas if you go to people that are not subjected to all the kind of style of things that we experience in the urban areas, you go to the rural where the air is at its potency, then you find these people's brains and memories and intellect, it's as sharp as they cannot even compete with students at universities. So all these things that we're subjected to that work against nature or against creation, they are having an effect in us. Then we say, oh, it's age. Of course, it will be age because it's so many years of being exposed, as opposed to this one, a younger one, who is not as having a long duration of exposure. But if you look now at the young people that you compare with us, you actually, it fries your brain. It's like, really? I mean, these kids, I don't know how far they're going to go with how their brains are being badly, adversely affected. I don't know, seriously. I don't know what's going to happen. The memory.
Okay, thank you. Thembi, yeah. Can you start by giving us an example of someone you treated who had dementia?
Like I say, that when I agree to cover a certain topic or decide to cover a certain topic, I never want to cover a topic that I have not experienced. People having that particular condition and me treating them. Even with this dementia, I've got quite a few people, but this particular case takes the cake. It was an elderly lady, another who came with her daughter in Joburg. And of course, I could see that she was just nowhere. Absolutely, the dementia was so extensive. She was just nowhere. But she had come with the daughter, and there was no other third person who was going to look after her while I was giving the results. So she came with her in the consulting room. And when I was giving her the results, but the mother was a very civil lady. She was not the traumatic one so there was no reason for her even to panic that she was going to be part, because she was not disturbing us. She was just sitting there and buttoning her jacket, skew, this button, and then she would also unbutton, then she would button again, and she was just a child. She was nowhere, I promise you, she was absolutely nowhere. And she had frontotemporal dementia. Now, frontotemporal dementia is the dementia that affects not only the front and the temporal lobes, but it also affects the frontal lobe. But she was seriously affected in her temporal lobes. And so when I was giving the results, because that was also one of those cases of aldolase C deficiency, aldolase enzyme deficiency. So I even told the daughter that she must come because she did not have money to cover for them both. She said all the money that she's saved, she wants to make sure that it helps her mother. So she was going to come herself later on, because I said, your mother is seriously deficient on aldolase enzyme, and that's what is affecting her cognitive abilities. So I would like to scan you as well to see, so that you don't go the same fate. Because remember, people who you find have had parents that are demented, you find they themselves tend to have dementia as well. So it was aldolase deficiency, aldolase enzyme deficiency. And I gave her the results. I explained why, told her the diet. And then after a week, she said she had started giving. And she said the mother was not difficult. She said, because, all these pills, some of them she would swallow with the water. But so she was not sure whether she could open, because she felt, I remember I gave a lot of pills, a lot of capsules. So she wanted to know, because she was now fearing that the mother would start chewing. Then she would tell, no, don't chew, swallow. Because she could still follow certain instructions. So she wanted to know if she could open the capsules. So then I said, okay, she can open the capsules and mix them in water. And in fact, because she was fructose intolerant, she could not mix them in a fruit juice. So I advised her to use the cucumber, blend the cucumber with water and put in a bit of honey, and then throw in the capsules there. And she called to say it's working very well. She's drinking very well. And then after another week, she calls me. She said, she actually wrote me an email. This time she did not call. And she said, thank you, Sis Thembi, for bringing my mother back. She said, my mother is back. She can recognize me. She can talk sense. Now, she said, my mother is back. There's no other way of explaining. She said, my mother is just back, So that was one of the cases that I treated. But now remember, it doesn't mean all cases that of people that have got dementia, because the cause will be the same. No, but in this particular case, it was frontotemporal dementia, which was linked to aldolase C deficiency. So all the damage that had been done, I could actually deal with that. Because you must remember that the cells that have been destroyed can be repaired. The body and it's the body that's repairing them. You must just know what to give to the body so that it repairs. It is the one that does the work. You bring the brick, you bring cement, you bring water, you bring the scaffold, I don't know what you call this thing. Then the person who's building knows how he's going to use one. That's what the brain does. So that's what I did even in this case, that I gave that brain all the tools that it needed and removed the fruit that was destroying it, because aldolase C was not there. So what I'm saying there, for even this gentleman that I'm referring to, I promise you, if he was in South Africa, I would have reached out to him by now to say, just give it a try and see if you're not going to get your dad back.
Previous show, you gave an example of a parliamentarian who had poor memory, but the problem was kidneys. So how do you move from kidneys to brain?
Okay. Like I've said, every time when I talk, I say, you cannot move from a symptom. Because look, she had a seriously best memory. Okay? And this mama that I'm talking about had dementia, which is also a memory problem, but more extensive. But the interesting thing that is a common denominator here is that if you look at, even though these are two totally different cases, but I'm just going to mention one thing that may be a common denominator. But the kidneys do their own mess up. The brain does its own mess up. But if viewers can still remember, when I was talking about the temporal lobes in the case, I think it was polycythemia, when I was talking about when it affects the carotids and whatever. And I did mention that there are cases where you find people that have got temporal or carotid obstruction issues. They may have issues with the ears, for instance. Maybe the ear is making noise, or it feels blocked, or maybe they've got no balance, or whatever. And I mentioned that there are cases where parents, if the child has got persistent ear infection, they must look at the kidney. If the child has got a persistent ear infection that responds to nothing, look at the kidneys. And I even mentioned that if you look at the shape of a kidney, especially that has been cut, you see that it's like an ear, Yeah. So because the ear and the kidneys, they do share certain physiological, fluids, certain proteins, and what have you. So even though in this case, I'm not necessarily linking the parliamentarian one to the one with the dementia, but there is some connection between the kidney and the ear. And the other connection it's the temporal lobes, which is where memory is, the function of memory is sitting. So that would be one of those. But I'll come back. Let's go for a break. And when we come back, I will dwell more on Lorica's question.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adolase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat?
Welcome back. We are talking about dementia. And when we went for a break, I was responding to Lorica's questions as to how do I move from kidneys, as per my previous diagnosis of the parliamentarian, to dementia, which both are a sign of serious issues with memory. But now coming back to that question, Lorica, I specify and I emphasize, and without wavering, the importance of moving from the person to the symptom. Because if you move from the symptom to the person, the symptoms may be the same, but they come from totally different causes altogether. Like this parliamentarian, for instance. The kidneys were a problem, and we had to treat the kidneys. But in this case, it's not. It's aldolase enzyme deficiency, which is affecting the brain. So we're dealing with the brain directly. There's nothing that connects us to the kidney. Even though before we went for a break, I was still, though, showing that there might be some, not these particular cases, but between the kidney and the brain and the ear, the mind. So, but bottom line is, you cannot move from a symptom because it will throw you there. Because like in the case of a parliamentary, like I was talking now, even though I would give something to trigger the memory, to jumpstart it, but I won't be able to fix that memory without fixing that kidney. So even if you were to focus on giving something for the memory, you find it's not working because the kidney is the culprit. That's what is causing that memory to deteriorate like that. In this particular person, it's fructose intolerance, it's aldolase C deficiency. That's what's bashing that brain. So I cannot treat that without fixing the aldolase deficiency and stopping the fruit from keeping on to cause the problems. So this question that you're asking is actually confirming or even emphasizing my point of departure and my notion of conventional medicine needing to revisit their way of diagnosing, because moving from the symptom, I promise you, it's going to throw you in the danger because of how it may mislead you. Like, for instance, I was talking about in the previous episode about that child, that boy who had seizures, that's bashing the brain, but the cause is the pancreas. So you're looking there in the brain, the neurosurgeon. Meanwhile, you need an endocrinologist, a doctor who specializes in the endocrine system to deal with that problem of epilepsy. So it's just confirming my standpoint that you cannot think you will go far if you're moving from the symptom and think it's gonna give you something substantial. But anyway, yeah.
Thank you, Thembi. How do you treat the dementia? Or should I ask if it is reversible?
Yeah, like I gave an example of this particular lady whose mother came back. That was a reversal of dementia. Okay. Now, you must remember that with my scan, I'm in a position to see where is the cause of the problem. What is the problem that has brought you here? Even though most people don't tell me what has brought them there, they will just say, no, they will say, not applicable. When you're asking if there's any particular condition or problem that they have, they will say, not applicable, or they will not even respond, because it's a way of testing me if I can detect what is wrong or not. So my point of departure is my scan will show me what is the problem, what is causing that particular symptom, and where are the other defining or contributory factors in your body that are making this thing worse, or maybe, So even in the brain, therefore, when you've got dementia, I will be able to see what is causing your brain cells to die. In some cases, like for instance, I mentioned this case in the previous episodes, where I had this gentleman who had TB meningitis and serious cognitive decline, because TB meningitis was bashing his brain. So this is someone who's educated, a scientist, who's holding a good job in his company, but whose cognitive decline was just shooting down because he had this TB meningitis. So now when they had given him the medication that was stopping, that arrested the bacteria, the TB bacteria, they now released him to a rehabilitative hospital where they take people that still need to be supervised, kind of 24/7 kind of supervision, but who are no longer needing the drip and the whatnot. So he was discharged transferred to this hospital. And in this hospital, when they called me to give me a report, because I stood in as a relative, I did not tell them, this is my patient. I stood in as a relative. Now, in his report, because I had a physiotherapist, a clinical psychologist, a medical doctor, and it was a multidisciplinary, meeting. So now the doctor was the first one to give a report. So he tells me that this guy has got dementia. He's got brain atrophy. The brain cells have died. There's quite a few of the brain cells that are shrinking, that have shrunk because of the bacteria. So he has got dementia, and they don't see him coming back to normality. That's how extensive the damage was. Of course, he was not just having dementia, because remember, dementia, the memory is buggered, okay? But he was not just only having that. He was also having aphasia, which is, you would ask him a question, like, for instance, he liked classical music. And he was, we used to discuss before he got sick, because he's an old client of mine, he's also Catholic, so we discussed Catholic issues and music and whatever. So, but because I know then I would ask, who is this? And then I would play that particular classical music, and I would ask, who is this? And they'd say, Beethoven. Okay, which symphony? Symphony 5. But then I would play another one, which is not Beethoven. And then I would ask, who is this? And say, Beethoven. So everything was Beethoven. Okay, but that was not the problem. But now when it came to where I saw that he actually had aphasia, I would ask him, like, for instance, maybe something political. And he would, not like he cannot find words, but he's struggling to connect the topic to his brain so that he comes up with the answer. Then I would say, you understand my question, yeah? Then then he would, like, he's kind of, and he would just keep quiet and just put his head like this. Because he's frustrated, he knows what I'm talking about, but he doesn't know, because there's a discord now between the language and the output, the processing of that information, and then the output. So he would not be able to give me the output. So those were the reports that I had been given, that which I had myself also observed, because these I would be doing myself. So they told me he must just be on 6 months disability, but with a proviso that he would not come back, from where he is. I managed to reverse all that. All that. He is back into the type of work that he was doing before he fell sick. Such that even his company, but he stayed with us for a full 5 months, such that his company, they put him on 30 days observation when he was back, because, they were shocked that this is now a normal person, but is he really capable of going back to his work? So they put him on 30 days where he would just be, and he said, I'm special. When he was giving, he said, I'm such a special person because I've now got someone who's working. If I want to go to the canteen, this person is, what do you need? Anything, Mr. So-and-so? And I say, I've got that. And even when I go home, I don't take public transport anymore. They take me with the company car. They drop me at home. They fetch me. So they were monitoring him. If I would say they would help, they would say maybe also sleep at his place as well. So they were monitoring him around the clock because they wanted to make sure he's really together. And they realized he's really together after 30 days. So his back is doing his work, old work that he used to do. So I'm just giving this an example to say this is something that is totally reversible. Because in my case, I can see this is what is happening. Like I gave the example of the lady with her mother. It was elderly C deficiency. She's fructose intolerant. Stop taking fruit. Stop giving her fruit. This one, it's TB meningitis. So give him because even that, I had to help them to identify that. So give him treatment for bacteria, to contain the bacteria. And then once we've contained that which is causing him to have these issues, then I can repair. Those brain cells can be repaired. I promise you they can be repaired. So if viewers you've got a relative who is nowhere, who is absolutely nowhere, you don't know, but of course it's usually very difficult when to bring someone who's totally nowhere, because even to keep them still is a problem so that we can scan them. And then you find, so it's usually difficult. So you need someone who's like this lady's mother, who was not, dramatic, who's not violent, who can listen to the instruction. Like even in this case of this guy with TB meningitis. But what I'm getting at is, even in situations where you find that I cannot be able maybe to scan the person, but I can still pick up certain things intuitively, and I'll be able to give the medication that can start to arrest whatever's causing the situation or the symptoms, so that we're in a position to eventually scan the person. But I can do that. I can do that as well. As long as you'll be in a position to make the person drink. Because that's the problem. If the person cannot drink, then there's also nothing I can do. Unless the person is in hospital and they can feed them with a peg, then we can because I've also had situations like that where the person, although it was not dementia, it was something else. And then the person, that doctor, which I found really out of this world, that he allowed that alternative medication would be administered. But because the wife was a nurse, so she was able to feed him, to give him the medication with the pack, because, like feeding tubes. So I can reverse because I can see what is causing the dementia. And then I will be able to repair those brain cells, Even with voltage, we've got voltage treatment, even though we have not used it to its maximum capacity. But voltage, the doctor who developed voltage equipment, he tested it on a child who had drowned in a swimming pool and was in a coma. So he was just supported by the life support. And then he asked the parents that they've got nothing to lose. Can he at least do the voltage? Because he was surprised what it had done to him, because he started it on him and then he saw what it did to him. And then he went then the parents allowed him. And then he started working on this child, treating him with voltage treatment. And that child came out of the coma. And then he continued, but he was still blind. He could not hear, he could not talk, but at least he was out of the coma. So he continued working with him up to a point where that child totally recovered, totally. Such that I did mention this story in some of the previous episodes, that he said this child was a maths boffin. He said, I cannot compete with him in maths. That's how much of a master he is in mathematics. He says, I don't know if it is the voltage treatment that maybe escalated his abilities, or he was that good even from the onset, So, but what I'm saying is there are methods, there are medicines, there are techniques that can be used to actually bring people back into life.
I hear people talking about Alzheimer's. Is it dementia?
Yeah, Alzheimer's is a type of dementia. There are different types of dementia. Dementia is dementia, memory loss. But the levels of deterioration, they differ. Like, for instance, when I mentioned that this lady's mom, it was frontotemporal dementia. It affected the frontal lobe as well. Alzheimer's is dementia. It's a type of dementia. But like I've said earlier, you'll find that people that have got Alzheimer's, conventional has accepted that once you have Alzheimer's, that's it. That's a done deal. It can, I sometimes wish I could go to these institutions where these makulus are staying and say, guys, just let me work. Just give me one. Don't give me two. Give me one. And then give me another one. And then another one. Because if I have a whole lot of them, you must just give me one that I'm going to focus on. And then give me another one. Can't give me. Because you're going to end up chasing me once you see that I can actually reverse, these people with Alzheimer's. So it can be reversed, Lorica. And the important part that I want to stress, you've got to know what is causing Alzheimer's in this particular person. What is causing dementia in this particular person? Once you've got that, that's your departure point. Up until you know that, you're going to fumble. You're going to fumble. But once you know this is what has caused it, then you know that you must go this direction. Even though you will still give medication that assists the memory to come back, but without stopping the thing that is destroying that memory, you're gonna keep on hammering on the same like a broken record. You need to find out, why is this person having Alzheimer's? And don't say it is old age, for goodness sake, because that is nothing, there's nothing like that. Don't say it is old age that causes Alzheimer's. But anyway, this is where we end our show today. If you're sitting with someone that you know has got memory loss, even if it has not reached levels where you feel icon, once you start forgetting, seriously forgetting things, or even at school you find you cannot remember the work that you have covered, and it used to be a piece of cake to do that. Something is happening to that brain, and I'll be able to tell you what is, and then we can see how we help you. So that is where we end our show today. Thank you for watching, and goodbye.
Thank you for watching, viewers. Don't hesitate to make your booking for the Dr. Alternative. Thank you.
On the next episode of Dr. Alternative Show, we discuss the condition of endometriosis.
Doctors have seen this as a gynecological problem. What is your comment on that?
Don't miss it.